My name is Dan Miller, practicing PT of 25 years and growingly passionate about what we as therapists are capable of accomplishing within such complex presentations as chronic pain, circulatory compromise, and resultant movement-based impedances. We now have the distinct pleasure of meeting Julie, who I've been working with. Julie, if you could share with our audience a little bit about your experience with breast cancer and what you've been working on of late, and just in your own words, that'd be wonderful.
Yeah. So I'm 6 months out from diagnosis of, it was stage 1 breast cancer. I had a lumpectomy in March and radiation for pretty much the month of May. I started experiencing some edema in my arm and under my arm on the surgical side mid to late June, and have been working with occupational therapies and doing some manual lymphatic drainage, both in the office with them once a week or every other week, and then I have exercises that I do on my own as well. And recently started also doing the breathing exercises, the circulatory work that you and I have talked about, as well as using the UE Ranger to help with the motion of my arm. I will tell you the biggest benefit for me is that fact that I'm not necessarily someone who's has not all that been in tuned to my body and what happens. Obviously cancer changed that a little bit. And so I really feel like the biggest benefit for me is the fact that the exercises make me feel more centered. I'm forced kind of to take those breaths and be present. And for the Ranger, the piece for me is the fact that I'm in control of all the movements. There's a lot that was taken out of my control with cancer, and this is a way for me to have some control over that. I control all the movements with my other hand, it brings me kind of the whole thing, the whole piece, the whole picture, brings it back together for me, and makes me feel a whole lot more centered.
Okay, wonderful. So we're going to take what Julie has just said and demonstrate for you the exercises that she is referring to. The UE Ranger allows you to integrate its support into your natural preferred interventions. So no differently than we normally do with our patients, we want to assess their current capacity. And so what I'd like to ask of Julie is, Julie, just with your day-to-day use of your arm, what are you experiencing when you use your arm, and to what extent are your limits? So just kind of share what you personally are experiencing.
Yeah, I can raise my hand above my head fairly easily.
Okay.
There is, for me, the issue is tightness, and I have tightness all through here and down because I'm more swollen in my torso. And so I don't have so much in my shoulder where I am, but it's more tight for me. And so in my normal daily life, I don't do a lot of arm movements, but when I do have to, it's really tightness for me that's the issue.
What about fatigability? Are you, because you don't use your arm a lot, you're probably not fatiguing sleep?
No, not really. I don't do a lot of upper body work necessarily. I would imagine if I did, it would probably be tired quicker, for sure.
Okay, gotcha. And so the concentration of tightness is where the concentration of your swelling is. Okay, and then one other thing that I just will share with you that I gleaned from your motion, if you could bring your arm back down, and for the audience, if you just do it a little bit slower, just your initiation of motion. Okay, and then back down. And so what I'm looking for is just how you recruit your muscles, okay? And so there's just kind of an occurrence where you do a little bit of a shrug before you go up. And so that's just a component that we'll want to look at to make sure we get the mechanics restored, so the muscles are communicating again. So we'll begin with this. So what I've done is I've measured Julie to be at elbow height or slightly below, and just gaining the assurance that you're comfortable with that. And what we're going to try to accomplish in the very beginning is essentially a differentiation of movement of the shoulder joint, okay? So we want this humeral head, your arm, to move freely in the socket, okay? Now what the benefit of that is the nervous system has been used to bundling and protecting, and with swelling it's just further enhanced that she's going to be apprehensive about movement. And so it's subtle, but on a neurological level, if we can restore this freedom of movement through here, your nervous system will just recognize movement to be, desirable versus something it has to continue to labor to protect. And in that process, you're not experiencing pain, but I believe that's probably where a portion of your muscles are becoming inhibited, where they're just not given the message that they're supposed to be participating. So we have to clean that up a little bit in order for the muscles to play along, okay? So we're just going to try to get this humeral head to be free in the socket, okay? So I'll ask you, Julie, to place your non-involved hand on top. And so at the very beginning, what I've asked Julie to do at home is to just simply let her right arm do the work. So the left arm's along for a ride. So it's a form of passive mobility versus the necessity of doing things like pendulums, where this tool can offer support and be very relaxing to her. And Julie mentioned in her testimony that this gives her the confidence she's in control of the movement. And so that to the nervous system is again a trust, okay? Progressing this, if you place your hand on the back, and you can just think like you're reaching for something. So that just involves more of the distal upper extremity. And you want to be careful just not to lead with this shoulder, okay? We'll get to that. But in this passive part, the relaxing part, the feeling part, just let the right arm do the work. And here's where you want to kind of just circle back and ask yourself, are you breathing? Making sure you're not holding your breath. It's fascinating. Even if we just concentrate, like threading a needle, we're inclined to hold our breath. Okay, so it's just one of those variables that becomes really entrenched in the protection that we hold our breath. But that's a deterrent to healing, okay? And then we'll progress. So then she can take her right arm down, and as she gets more successful with this, in combination with that A-OK, is then you can just produce that same movement on your own, okay, on the capacity of the left upper extremity. Another thing to help is if you put your left foot a little bit ahead of where it is right now, just to kind of distribute your weight a little more fluidly, okay? It just helps you to kind of use your legs with the movement. So it's a whole body contribution. And that's where it brings it down to your true core. As we start to lift, we want to recognize the core. But the value of the tool, she's not gripping with a rigid bar or pulleys as she begins to move, and therefore this communication of subtlety can be reorganized efficiently as opposed to laboring with one of those rigid devices or anything that requires gripping, because that just clouds the picture of something that's so finely programmed that we're trying to intervene in a history. So it's really subtle. So we want to have the right support to be fluid with the person's body, and then a graded progression into their specific functional requirements. Okay, so we'll progress now to a higher level of elevation, so we get up into where you've recognized a tightness, okay? As Julia shared with us, her current principal concern is tightness, corresponding with her swelling being principally in her torso region. But yet, as we have noticed, she's also demonstrating some hiking of her shoulder, so we don't want to get out in front of just chasing symptoms. Instead, we want to be objective and just make sure that mechanically we're getting everything in order so that your muscles have a good coordination. As you start to vary your demands of life, you can be assured that your shoulder is going to hold up for you, okay? And so the Ranger offers just an adjustment of height. And Julia, I'll have you back up just a half a step. You just didn't want to crowd you, but so we want to still begin with the initiation of motion, the preservation of that spinning okay? And a kind of a good cue for yourself is if you feel like the fingers are leading towards an intentional task, like you're going to grab something off the counter, feel like you're leading with the fingers and the elbow follows, okay? The elbow tends to want to follow the shoulder, but we want the fingers to lead, kind of like the eye-hand coordination, and that just sends a message to the shoulder to kind of follow that intention instead of the shoulder getting out in front, okay? And then you can just be creative with various progressions of elevation that a patient can use a standard stair at home or 2 stairs. You get beyond 2 stairs and they tend to reach. So you want to be creative like with a stepping stool, or what I'll show next is a wall mount or a door mount that you can use at home. And so then we just want to look closely that you're preserving the free spin, and you can combine that A-OK in thought as you initiate the motion. And that should be met with a sense of stability, like you feel like it grounds you, okay? And then again, just check your breathing. And then to support your manual lymphatic work, as we get to any portion where you sense that our next stage towards her tightness is of concern, you could be doing manual work to work the scapula, or I could have her just pause here at a point of lengthening, and then I could do manual circulatory support as we recognize soft tissue adhesions or accumulation of swelling, and just do your specific techniques in conjunction with the support of the tool so that you're not laboring to hold the weight of the arm in a functional position. And of course, we monitor with the patient when that gets to be fatiguing. So we're integrating the entire picture within function and within the recovery of the nervous system, breathing, posture, mechanics. Okay, so then we just could progress up, or we could go back down. So we want to kind of start with a traditional warm-up, a challenge, and then a cool down. So just allowing all that to be integrated into the current capacity of what we're trying to target. Okay? A nice application of the upper extremity ranger is to work in a side-lying position. So again, as Julie has indicated, that her symptoms are principally in the region of somewhere 90 to 100 degrees of elevation. And as we know from our biomechanics, 50 to 70 degrees, there's the requirement of the scapula to start participating in the mechanics. And so what I showed earlier of the humeral head moving freely in the socket, now we want to make sure the scapula is going to move on your body, okay? So as we elevate, we have to have that shoulder blade actually be a part of the movement. And down here, it's just the arm. Up here, it's working together. And so what this offers is a gravity-reduced position that we can target. So I'm going to try to just feel where Julie feels to be any form of sluggishness with her movement, where the freedom is just deterred by swelling or soft tissue changes. So can you kind of feel like right in there? Mm-hmm. So that's well below what she showed to where she was symptomatic. So, you know, the impedance of motion begins a lot earlier. She felt it way up here, but we want to target treatment down here. Is that comfortable there? Mm-hmm. So what I would do then is I would come back here, and just what we know about breathing and protection, that inverted core just tends to close us. And so this is just one position where you can start to integrate that knowledge into application. So I would assess her segments of her spine, the adjoining ribs, and the scapula, and just try to work exactly where her impedances are, and then progress into movement accordingly. Similarly, I can work on a circulatory level like I showed earlier, and just doing the manual lymphatic drainage while she's in a position of progression on that mechanical level. And so we're just, again, tying it all together. And then when we're finished with that, then we want to just then try to work before and after, kind of the warm-up challenge principle. And just get an idea of her fatigability within the changes we're making here. And just monitor your breathing, Julie. And I'm just going to try to work with you now as you're moving. Try to think of your A-OKs when you initiate the motion. Okay, take a break a moment. And so a common, I guess, occurrence in this position at times is when a patient lays down, they don't necessarily shut off all their muscles. So what I do sometimes after making sure the pillows are at the right height for her neck is, Julie, I'll ask you just to lightly touch your forehead with your right hand. And then just ask yourself, do you feel more relaxed in that position with your fingers lightly touching your head for your neck?
Yes.
Okay, so that is just a simple exercise. You can quickly have them touch their head, and it's just a method of learning to relax the neck, because that's a portion of that protection, the inverted core, that we can just, again, remind the body where to work from and where not to work from. And then she can monitor that. The calmness of her neck, the rest of her body can somewhat experience that, and then the energy could be placed into her foundational core that we're trying to recover. And then to the function of the shoulder. So I can just kind of feel how that just really relaxed her, and now she's just moving. And sometimes what I'm experiencing now is that sometimes, I'll have you rest there a sec, Julie, sometimes the shoulder, the involved shoulder, will actually start to shake. And what that represents is it's somewhat of a revealing, if you will, of the true weakness of the person's shoulder. Sometimes, we just get tired and we just let it drop. But when you feel shaking, that means that you've reached the depth of need on a motor level. And you want to then just allow the nervous system to experience that such that it knows those muscles are available, obviously not overworking it and provoking, a protective response. But that's kind of a threshold, if you will, of gain, where we've represented that the nervous system can let go of the protection, the substitutions, and then you see the full need, the depth of need, and that's where you want to condition. With all these pieces working in harmony, you're conditioning a true therapeutic influence. Okay, so now we'll move on to the wall mount and progress to a closed kinetic chain with the support of the Ranger. Progressing Julie's elevation now to, again, against gravity, we have the benefit of the wall mount, and at home the version of a door mount. And so the benefit of this is it creates an arc of motion such that as the tool goes up, it goes over an arc. And what you want your patients to do is to just continue to trust the weight of their arm to the weight of the tool or the support of the tool. Now, Julie has demonstrated that this is fatiguing to her. So we're right on the threshold of where she gets tired, but also a little bit beyond her stiffness. So we're using what we did in side lying and now more functionally. But as she starts to fatigue like she is now, I would just want to bring her down and just really monitor that so she doesn't become symptomatic. But then still I might pause there and we could do just some, again, lymphatic drainage to just incorporate that message as we finish this session. So there's a carryover of everything that we've done. We want to unite those messages so that circulation is recognized as complementary as we restore function. Is that a good height now?
Mm-hmm.
Okay. Now finally, well, there's one other option in this position that I'll just mention, and that's just, just some proximal stabilization. If she's having trouble really finding that rotator cuff or her lower trap, we could do some dynamic stabilization where she just stabilizes as I try to push you, okay? Another thing that works really good here is if we go back to that motion of thinking of hugging someone, So Julie, I'll have you try that. We'll just finish with that. So literally go out and around like you're hugging someone, like we hug half a hug with a friend. Okay? Someone a little bit taller than you want to think like you're going out and around. And what that does is that targets the lower trapezius here. And so dynamically, she can find her shoulder blade and recognize that shoulder blade to be in her control as she's elevating. Can you feel that?
Mm-hmm.
Okay, so that can greatly reduce the work that she's exerting, and then therefore her fatigability should be less, okay?
Mm-hmm.
So we're actually recovering as a whole. So I'll bring you down one more level and just do a cool down now, and then I'll put you on the ground and we'll just do a few more strokes to end with. Okay, let's come out and we'll just go to the ground. And that's a good height for you. Let's go with your right arm back on top and just end with just kind of gently cradling your shoulder, if you will, just nurturing that. It's done a lot of work, so just let it come to a pause now. Remind yourself of the breathing, just the calm, so that you end with a good message of therapy to carry over with.